Hi, and welcome. I'm Elizabeth Chadri, Program Director at the Oak Park Rural Forest Community Foundation, and today I'll be sharing with you our community grant strategy. The foundation is activating our promise to the community to advance racial equity in two significant ways: through our mission-aligned investments and new investment policy, and now through our discretionary grant making, the Community Grants Program. In 2022, we released a special Community Needs Assessment, our Community Voices report. This report has been central to our decision-making and our plans for the future. Through focus group conversations and compiling hard data from partners at Northern Trust, we heard 4 large interrelated issue areas. People are seeking access to education, wealth, healthcare, including mental health, and safety and belonging. Together with staff and board, we enlisted the advice and counsel of practitioners and community members living these challenges day to day. We expanded our grants and programs committee to include them in setting forth the focus and strategies we're sharing with you today. As you all know, these issues are not standalone problems. They are broad and interconnected. Looking at our resources, our networks, our expertise, and our funding, we clarified an area that aligns with our work and our mission, and that collectively the group felt would have the greatest impact and be the most responsive to the community's expressed needs. It's important to note that throughout all of this, racial equity is embedded as both a process and an outcome. What do we mean when we say racial equity is embedded throughout as both a process and as an outcome? Here are guiding principles and process. So we ground our work in stories, context, history, and data of those with lived experience. We focus on systems change in addition to programs and services. We shift power within our collaborative to the affected, be willing to change the decision-making process, and listen to and act with community. Recognize community members as assets with a wide range of perspectives, and build equity leadership and accountability. Leaders should reflect the diversity of the community, recognize their role in maintaining the status quo, and be held accountable for their own progress. We've taken these principles to heart internally from our staff and board, makeup and training, to our policies and practices, everything we do. We strive to live by these actions, and we're very intentional in including them in our community grants program. The overall goal is to promote a community of safety and belonging across West Cook County by supporting organizations and collaborative efforts that improve access to and quality of mental and behavioral health for our youth and young adult residents. Here are some important and somewhat alarming statistics. 1 in 6 children aged 6 to 17 and 1 in 3 young adults aged 18 to 24 experience a mental illness or disorder each year. Yet mental and behavioral health has long been underfunded by philanthropy, particularly in comparison to physical health. Also, 50% of all lifetime mental illness begins by age 14 and 75% by age 24. The average delay between onset of mental illness symptoms and treatment is 11 years. And nearly 5 million people in Illinois live in a community that does not have enough mental health professionals. So we are pinpointing our work on 2 priority areas: workforce development and access to and/or provision of services and treatment. Let's first look at workforce development. The desired outcome is to expand and diversify behavioral and mental health professionals and paraprofessionals, with an emphasis on BIPOC practitioners. Another quote from our research: a lack of providers for communities who desperately need these services and lack of providers who are reflective of the communities they serve. Recruiting people of color to provide these services is definitely a barrier. It's not just a matter of recruitment and training, but also ongoing support for staff we need funding for. So regarding access to and/or provision of services and treatment, the desired outcomes are increased access to mental and behavioral health services for youth and young adults, increased opportunities for early identification of and treatment of mental and behavioral health, reduced stigma related to use of mental and behavioral health services by youth and young adults, the importance of peer-led supports and connecting children with services as early as possible to prevent more acute future needs came up frequently in interviews. Here's one quote: "We've heard the desire for more peer-led approaches. Our communication, including literature and other materials, need to be more youth-friendly. We definitely need more peer-to-peer support." That's a quote from a public health educator. So let's look at eligibility and other guidelines. So the applicant organization should be qualified as a 501c3 public charity, or the applicant organization should operate under the fiscal agency of an organization that is a qualified 501c3 public charity. And if a past grantee, the applicant should be in good standing with the community foundation. The geographical areas of focus are Austin, Berwyn, Broadview, Cicero, Elmwood Park, Forest Park, Galewood, Maywood, Melrose Park, Oak Park, and River Forest. These areas are areas that surround Oak Park and River Forest. As for the funding parameters, applicants are limited to 1 application during this grant cycle. The grant awards will be up to $20,000, and it's for 1 year. Grants are awarded for 1 year. The grant requests may be awarded with full or partial funding, and will fund both general operating or program and project grants. And as for the timeline and the way forward, we held 2 information sessions this month, and the RFP has been shared via email and on our website. The deadline for applications is Friday, October 11th, and grant notifications will be no later than January 31st, 2025. So in conclusion, we will provide 1-year grants. We will form and support a steering committee. We'll identify 20 to 25 individual community partners, those with lived experience, organizational or sector experience, and policymakers, to co-opt and co-design multi-year community-driven programs and activities which expand and or improve workforce, as well as access to services and treatment. We will convene the steering committee and other partners, and we expect the steering committee will meet at least 3 times a year to build relationships and partnerships, share learnings and experiences, share decision-making and power building with each other and with the foundation, including joint opportunities for advocacy and addressing policy to lead to systemic change. We'll then implement the funding criteria and process for multi-year grant program. The program will be community designed and driven by the steering committee, working together with the staff. The community, together with this steering committee, will set measurements for reporting, and the reporting will include both stories and data. So, thank you very much for all you do for our community. If you have any questions, please do not hesitate to reach out.